Good afternoon, everyone. My name is Alan Harris, Emergency Manager here in Seminole County, and this is our Facebook Live update on the 8th of May. So I want to thank y'all for joining me again. We'll be doing the live update from 12 to 12:25 as we normally do, and then immediately following us at 12:30, the Seminole County Public Schools also does a Facebook Live. So just flip over to their site, and you can see Walt Griffin, the superintendent of schools, and the folks over at the Seminole County Public School System for an update. Giving you a little update here in Seminole County, we currently are at 410 positive cases since the event has begun. 8 of those being non-Seminole County residents, and the remainder being Seminole County residents. If you haven't checked it out, you certainly want to check out our dashboard that we have provided. So we provided a lot of numbers to you. I know a lot of people are looking at the different types of numbers and statistics, so we've tried to provide some good numbers for you on that dashboard. If you go to our website, prepareseminole.org, and click on the COVID-19 response, at the very top there will be an image there where you can click on that and you can see the dashboard. Yesterday, the Florida Department of Health in Tallahassee started providing recovered numbers. So you will now see a new number on that dashboard, which is recovered. So you'll start to see that now, and you can look at that number, and you can by that identify about how many people are currently sick in the county. Now, I say that that's people that are sick that have got tested that we know about. Obviously, people that are sick that never have gotten a test, we obviously wouldn't know about those individuals, as well as anyone that is asymptomatic. Of course, we wouldn't know anything about those individuals as well. So far, our testing has ramped up quite a bit. 2 weeks ago, we had about 4,000 tests. We are now at 10,216 tests completed here in Seminole County with results back. So there's still about 1,000 tests, maybe a little less than that, that are still outstanding. So those are tests that have gone to the labs and we haven't received those back yet. Those are from the drive-through sites and the pop-up sites that we had in a couple different neighborhoods. Currently, we're at 4.01% positive. Now that has obviously come down quite a bit. The percentage when we were only testing sick individuals was about 10 to 11%. Now that we are testing anyone that wants a test in the county can go get a test. So the number has dropped. We knew that would probably be the case, and certainly it did become the case. So that number continues to drop as we continue to have the drive-through sites, and anyone, no matter if you have a symptom or not, you can get a COVID-19 test here in Seminole County. Since the beginning, we've had over 27 individuals hospitalized. Currently we have 27 individuals that are hospitalized. 5 of those have confirmed COVID-19, and 22 of those are being tested for COVID-19. So right now, 27 individuals hospitalized, 5 with confirmed COVID-19, 22 are being tested. DOH has cleared a number of patients, and again, that number is listed there on our dashboard. So just if you go to prepareseminole.org, you can click on the dashboard and you can get those numbers. I'm sorry to report, since our Facebook Live on Tuesday, we did have another fatality. So we are now at 10 dead here in Seminole County related to COVID-19. Those 10 individuals, COVID-19 was the cause of death on those. For testing, I want to give you a real quick update. We're very excited to have Saturday testing at a couple different locations on this Saturday, and this is targeted towards our Latin and Hispanic populations. So this Saturday, the American Muslim Clinic and Bueno Pharmacy, along with the Florida Department of Health, will start testing, and they'll test at the Iglesia Cristiana Hispana at 1643 Disciples Point in Castleberry. To register for that, you can call 407-588-0556. Again, 407-588-0556. This is it is a reservation only required program. So if you want to get that, you can go and there, but you need to make a reservation. We also have the information with the telephone number and a link to register at our website, again, prepareseminole.org. Next Saturday, we'll be at the Iglesia Presbyterian on Red Buck Lake Road, and then the following Saturday, we'll be at the St. Mary Magdalene Church in Altamont Springs. Allied Health is wrapping up their testing in Altamont Springs. There's a few test reservations still available for the hour time frames. So if you go to our website, you can register for that, or you can call our Citizens Hotline and you can register as well, 407-665-0000. We're closing down that site because the Altamont Mall will be opening next Tuesday. So we wanted to clear out the site and give them their parking lot back. So we will be closing down, and Altamont Mall again will be opening next Tuesday. As you remember, last Friday, the site up in Seminole Town Center Mall, which was run by Advent Health, was closed down. And of course, the Seminole Town Center Mall opened up Monday, and of course, Oviedo Mall opened up Monday as well. We will have drive-through testing here in Seminole County, even though we are closing down that site. We will be moving Allied Health to the Seminole State College main campus on Weldon. You can get that either off of Lake Mary Boulevard, or you can get it off. You can get to it off of 1792. So it'll be the site will be backed by the automotive wing of the college. So if you know where that is, that's on the west side of the campus. So you can there'll be signage there, so you can make a reservation and then just go to the location. Reservations can be made again by going to our website, or you can call the Citizens Information Line 407-665-0000 to make a reservation for that one. We are hoping to have antibody testing available on the 18th. We're working closely with Allied Health to get that, so that'll be a community location where the community can come out and get an antibody test. It is requiring a blood draw, so it won't be a drive-through type of site. It'll be a go into a building type of site. So, but we're hoping to have that available to you by the 18th, so the following Saturday, not this coming up Saturday, but the following Saturday. If you want to get an antibody test before then, you can go to one of the private healthcare providers that are providing that service right now. Urgent Care of Longwood is providing that service. Stages of Life Medical Institute is providing that service. LabCorp. So with LabCorp and also with Quest, you can get a prescription from your primary physician's office and then go to LabCorp or Quest. If you don't have a private primary physician that you see regularly, then you can go to contact LabCorp, do a telemedicine with their doctor, get a prescription, and then you can go to get the test. So that's it for the antibody testing. Let's see, PPE, personal protective equipment. A lot of businesses have reopened and needed personal protective equipment. They want to maybe get a face covering or something like that. So our Economic Development Department put together a list of potential PPE distributors. That is also on our website, so you can go to prepareseminole.org and you can look for the PPE, whatever your business may want. We've had a lot of phone calls coming in. Where can I get them? We want to get them for the staff, things like that. So certainly we want to try to help you in the best we can. So the Economic Development Department put that list together. Here at the Emergency Operations Center, of course, we can continue to get PPE, and that PPE is specifically targeted to assisted living facilities and nursing homes. There are currently 121 healthcare facilities here in the county, assisted living facility, long-term care, and nursing homes that need assistance. So we've been providing that assistance. We've been providing that assistance from state resources, from the federal government to send some packages as well as some of the things we've had to get from private vendors. So we've worked with some private vendors to purchase items as well. To date, we have sent out 311,916 masks, 36,169 N95 respirators, 165,770 gloves, 22,176 face shields, 19,730 gallons, and 123,032 ounces of hand sanitizer. So a lot of logistics coming here, going through our logistics staging area, and then out to those on the front lines are medical staff that are in assisted living facilities and nursing homes, helping our most vulnerable in the community. So we're trying to, we're linking with those individuals, the administrators, every single week. We're contacting the ALFs and nursing homes every other day. So we are always in communications with those facilities to make sure that we are taking care of those individuals as best as possible. Marianne asked, I haven't received my results yet. My husband did. We went together. Can I get another test? You can certainly get another test. I know that at some sites, these are private labs. Everyone that we've worked with is a nonprofit lab, so they have a finite number of staff. So I'm sorry that it is taking a little long to get some of the results back. They are sending the positives immediately a phone call, so that may be some relief for you. Is that the phone call, we've been told by the nonprofits, if they get a positive test, they're immediately calling that individual. The other ones are taking a little bit longer. We do apologize about that. They're doing the best that they can. They're great people. A lot of them, volunteering their time. So we really appreciate the nonprofit organizations. Again, Allied Health, True Health, and those organizations. So you can certainly go get another test. There's absolutely no reason why you can't go get another test if you wish to. Monique and Angie, how are you? Said, can you help us with some rental assistance? Yes. So there are resources on prepareseminole.org for rental assistance. It's under the assistance tab. So if you go to the website, under the assistance tab, there's some assistance there for rental assistance. So if you go there, you can get some information on rental assistance. I know our community services department, I just nodded my head that way, like you would know. So I was nodding my head towards their building. They are processing applications right now for all types of assistance. So, but if you go to our website and just click under the assistance tab, you can get information on that. Pippi asked, is there a cost for the antibody testing? So we're hoping, again, Pippi, if you have insurance, please bring the medical insurance with you, a medical insurance card. If you don't have medical insurance, I don't know what the cost is going to be at this point. If you do have medical insurance, we're working with the Allied Health to try to get where there's no copay. So it would just be the medical insurance card that you would just swipe. Your medical insurance would be billed, but you wouldn't be billed. That's real important. So even if we can get down to no cost for folks, it is important to bring your medical insurance card because, number one, it allows us to do more testing. And that's even for the regular COVID-19 testing as well. So because these nonprofits only have a finite number of money so that they can get tests so that they can help our community. So please do what you can for that. Doctors, Marianne asked, do you need a doctor's order for antibody testing? No, you do not need that. You can absolutely go get an antibody test and you just make a reservation when we open the site, and you can do that. If you want to go to one of the ones I mentioned earlier, just call the facility. Those are doctor's offices, so they would be able just to help you there. Theo asked, where can I get antibody tests? Missed the info. So if you, at the end, we're going to have the recording on here. I talked about it in between the testing and the PPE. So if you go back there, I listed all. Also, you can just go to our website, prepareseminole.org. Again, prepareseminole.org for that information. John asked, haircuts, please. Haircuts, please. So Seminole County wants you to get a haircut. I mean, we do. Our order, there is nothing in Seminole County's laws, orders, anything that prevents you from getting a haircut. This is the state of Florida, Executive Order 20-112 that prevents it. We do not. We specifically adjusted our executive orders to allow it. That was one of the things when we all got together. We said we must do it. A personal story. I don't know if he wants me to tell you or not, but our medical doctor, his wife actually works at a hair salon, owns the hair salon. So we absolutely want hair salons salons to be able to open, personal services to be open, things like that. I don't need a haircut, but I know everybody else that wants to get a haircut certainly should be able to get a haircut. We all know that. So as soon as the governor changes his executive order, there is nothing in Seminole County that prevents you from getting a haircut. So, and I'm going to say that. So I'll say there's no haircut police that are going around trying to find barbers right now in the county. So you can take that from where you want to take that. Pippi says, but if you do it, just do it safely, right? I mean, everybody knows how to do that. Pippi says school opening info for 2021. So right after this, remember, Pippi, the Seminole County Public Schools will be on. Also next Thursday, Superintendent Griffin has agreed to come to our press conference. So next Thursday at 2 o'clock. Also tune in. So right after this, flip over to the Facebook on Seminole County Public Schools. They may have some information on that. I know I think they have some information on graduations and stuff like that as well. So they'll have some great information, I'm sure, for you. So certainly tune into that. Ponce the Barber, it's been 7 weeks since I've worked. Please help us reopen. So what have we done to reopen? So I mentioned on all the state calls that we have a state every single day. I've mentioned it on there. Chairman Zimbauer has written a letter to the governor to encourage them to open personal services. I can tell you that because I just got off a regional call, every senior elected official from Orange, Osceola, Lake, Volusia, we were all on that call together. Every senior elected official had written letters to the governor to encourage him to be able to allow personal services to regain. So, Ponce, we want you to open. I hope that it's this weekend when DeSantis makes this decision. Debbie, what's the difference between a COVID test and an antibody test? Good question. So COVID test is going to tell you if you have COVID right now. So it's going to tell you if you're positive or negative at this moment. So why don't I feel sick? There's another question. Well, why don't I feel sick? Do I even need one? Well, this particular virus also has asymptomatic individual. That means that you're not feeling any symptoms and you could actually have COVID-19. So that's why we're encouraging people. If you want one, if you just go through the drive-through, peace of mind, whatever, just knowledge, whatever. It's available to you. If you want to do it, it's available to you. The antibody testing will tell you if you've had it before and if you have any antibodies that may, and again, I'm not going to go too far down the road here, may help build up your resistance to COVID-19. The science is out on that. So there's a lot of science still, and I've read a lot of research. If you get an antibody test, you come back and you have antibodies, well, what does that mean? Well, I don't think that anyone knows what that means. Hopefully what it means is that you have some resistance to COVID-19, but we're not 100% positive. There's a lot of science out there. You can read lots of documents. You can go on right now to a couple websites and you can read about 15 different things on this. Some say you'll be good for about 6 months and you'll have some protection. Some say a year, some say weeks. But if you want peace of mind, well, you know what? I'll tell you personal. We were talking about it here, and one of the folks said, I had this weird virus in January. I didn't know what it was. It got me just horribly ill. Same symptoms. I'd like to know if I got it. So a lot of people are just going to get the antibody testing just to see if that thing that they had in January or February, was it or was it not? So you can do that if you want. Rich asked, any sites doing the saliva test? Not right this moment, Rich. The one that we're doing, Allied's doing at the Altamont site, the saliva test was done at Seminole State College, Seminole Town Center. But the one they're doing at the Altamont Mall is the nasal swab. The one that we'll be doing at Seminole State will be a nasal swab as well. So right now, I don't know of anyone doing the saliva test. Advent Health themselves are doing the saliva test. So if you go to a standalone ER or CentraCare, Just call them ahead of time, and they may have the saliva test for you. Jeanette asked, tested almost 2 weeks ago, still no results. Check missed calls. Jeanette, if you went to, well, actually, just do this. Can you call the Citizens Information Hotline? I'd like to get your information, and we will follow up with whoever. So I need to know where you got the test. If you can call the Citizens Information Hotline, let us know who you got the test from or what location, and we'll know because of the location that you got it done. Then we can get with the individual that took the test for you and try to trace that down somehow to get help with it. Norman asked, the county dashboard currently says 5 hospitalized. Is this current? That's current. So right now in Seminole County, we have 5 individuals that are hospitalized in the county with COVID-19. That's down quite a bit. We were hovering around 12 to 17 about a week and a half to 2 weeks ago. So it has dropped. It's dropped pretty dramatically. Veronica asked, when will libraries open? So when will libraries open? Well, libraries are slated to open next week, next Monday. Not all of them will open. Some of them are curbside service. Oh, I'm getting a no. So is that not the case? Okay, so they are going to announce the date. So I'm sorry. That was the projected date, but right now we're still working. We want to make sure that it's safe for everybody. So just keep on the Facebook page. I guarantee you we will post it and push it out. So thank you, Ashley, for correcting me. I saw a big shaking head no. So our targeted date was Monday, but that is not it at this point. So Veronica also asked about playgrounds. Also, Parks and Leisure Services is working on that. I don't have a date for that at this point. So we'll push that out too, right? When we get it from Parks and Leisure Services, when the playgrounds will reopen, we will push that out as well. Angela, how reliable are the antibody tests? Well, so there's a couple different ones. Finger prick, and then there's the full blood draw. So the one that we're going to be doing, not this coming Monday, but hopefully the following Monday, at our it'll be an open site here in the county. That'll be a full blood draw. They are starting the antibody testing at the Orange County Convention Center. That's the regional site, so you can certainly go down there and get one. That's the finger prick. Finger prick antibody test, from what we've heard, and there's a lot of research on this, is a little lower percentage of reliability than the full blood draw. So we opted, and working with Allied, to do the full blood draw. Again, we're still working on this, but that's the plan. Danelia asked about nail salons. Again, there's nothing in Seminole County's orders, books, anything that says nail salons, massage therapists, hair salons, those things can't open up. It is the governor's executive order. It is, we have encouraged them to allow that to happen. We have sent letters. We have talked on conference calls. We hope that he will make a decision. Is out of our hands. We cannot overrule the state of Florida. And our surrounding counties have done the same. So that's, we've done, and we continue to do to push that. So it is his phase 1 plan. So if you download the Safe Smart Step by Step, it is in that plan that those facilities can open in phase 1. We're seeing if he'll do that. So just so you know. Zahir asked, he said, Zahir, he said there's no haircut police. So if I'm not gonna. I can't say it. Y'all decide what you want to do. I'm not gonna go down that road. But I don't think there's any police officer out there looking for a barber right now. Pippi and Veronica, how long do antibody test results normally take? That is a great question. Give me a few, and I will reply. I'll have the public information staff reply directly to you on the social media. I honestly don't know. So I will get with the lab and see about how long those results come back. I was looking over at logistics to see if they knew off of their head, but so while they're doing that, they're trying to get an answer for me. Let me see. All right. Hey, Arlene asked about Seminole County School Live. Where can you find? Just go to the Seminole County Public School Facebook page, and it'll be there. Let's see. Hurricane prep, Taylor. So yeah, we've been working on that. We've been working on a shelter plan. In fact, we just had a conference call with the state about sheltering. So I had a meeting with Walt Griffin about that as well. So the Superintendent Griffin with the school board. Sheltering will not look the same. There's going to be a lot of differences related to that. If you're a special needs client, we have you in mind. We are working on that with the Department of Health. We have some enhanced medical services that we've already tuned into contracts for that. So we're working on that right now. So we are working on that for you. I am now at 12:25. I want to give you all time. Again, Seminole County Public Schools, it's their Facebook page. So if you go to their Facebook page, they should be on live on Facebook Live in just a few minutes. Thank you all. I hope you all have I forgot to say this. Happy Mother's Day, everyone. So I hope you all have a wonderful Mother's Day. We will be here on Sunday, certainly, and I know there's some mothers out there that have COVID-19 that we'll be calling on that day, and we're going to make sure that as special as it can be for them while they're suffering with the virus. But for those of you that are social distancing, I hope that you're able to get with your family, at least virtually, on that day. I want to wish you very, very happy Mother's Day. And Mom is watching. Mom, I love you. Happy Mother's Day. I'm sorry I can't be with you this year, but we will be together very, very soon. You all have a great week, and God bless.